My name is Dr. Michael Mwangi, practicing medical officer in Komarock Modern, and also the clinical director Komarock Modern Healthcare. Komarock Modern is a fully fledged 24-hour hospital that began in 2004. It had humble beginnings from 10 patients a day to now 300 patients a day. We have 3 branches. The first one was in Komarock. That's our mother branch actually. It's in Komarock sector 3A, Mombasa Road, which began in 2004. The second branch is in Utawala, began in 2016 in the Ndegeview Estate. Then we have a third branch in Tharaka-Nithi, Katwana. That one was launched in November 18th, 2018. Komarock Modern is able to provide all health services. Mainly, our mainstay is obstetric and gynecology with a fully fledged newborn unit. However, we're able to provide other services including surgical cases, all surgical cases, general surgery, orthopedic surgery, neurosurgery, pediatric surgery. Of course, I had mentioned about the obstetric surgical cases. Then we're able to provide pediatric health services. We're able to provide special clinics. These include dental units, we have optical services, we have physiotherapy services, we have dermatology services and ENT services. We have engaged visiting consultants, and anytime there's a case, we have a consultant coming on board to attend to the specific case. I'll just give you an example. We can have a neurosurgical case today. From the point you contact the doctor to the point the patient is fully settled in the ICU, within the same day the patient is attended to. If there is need for a surgical procedure, the intervention is done the same day. Our ICU is a 4-bed capacity. We have an attending anesthesiologist and qualified ICU nurses. We have 4 ventilators in the ICU. In our specialized clinics, what we do, we have specific days for each special clinic, with the exception to gynecology where we run them every other day. So you'll find that in each day of the week we have a special clinic. Our bed capacity in Komarock Modern is 200. That is in our 3 branches. Tharaka-Nithi is one of the biggest branches. The ICU of Tharaka-Nithi alone has an 18-bed ICU capacity. In Komarock Modern, we have a bed capacity of over 90. All right. Then our mother branch, which is smaller, she has over 50 beds. Komarock Modern, we have a state-of-the-art radiological department providing services in, we have CT scans, ultrasounds, we have OPG services.
So my name is S.K. Nyamu. I'm the CEO of Komarock Modern Healthcare. Basically, most of my time here, I'm also engaged in seeing my clients because I've also specialized in reproductive health. During this time of COVID-19, we have had 1 or 2 challenges. Of course, most of the clients are fearing to come to the hospital, so the number have greatly reduced. But as Komarock Modern Healthcare, we are fully prepared to basically take care of the clients that are coming. One, making sure that the environment in the hospital is safe enough for anybody who coming to seek care in the hospital. We have been able to make sure that all the centers or the areas anybody entering the hospital is screened. From even before the pandemic began, we were prepared for the pandemic. We have had several government entities coming and making sure that we also strengthening that. We have isolation rooms that any client that is suspected is isolated to make sure that even before the results or after the results, we know that this patient or this client will not either infect any of us as staff or the other patients. We have beds that are purely meant for those clients that are suspected to have COVID-19. We also have specific rooms in the ICU. We have a department in the ICU where you are basically able to isolate those patients that you suspect might be having a coronavirus. Since the facility here being level 5 and the other facility in Tharaka-Nithi, we have a duplicate of the same. We have been affected. I would say our clientele went down, reduced with around 25%, mostly in the outpatient. Our inpatient has not been affected as much. Actually, to be quite honest, my area of specialization, obstetrics and gynecology, has not really that much been affected because definitely ladies have to come and deliver, and of course they have to seek medical attention in terms of their antenatal care. So that area for me has not been affected. The only area that has been affected is basically the outpatient, especially when we have, because of the night curfew, people are not able to come to the hospital. We made arrangements as an institution to pick those clients that require to come to the hospital, and we are picking them for free using our ambulance during that curfew time. But otherwise, for now, things are going back to normal, not because the number of the infection has gone down, of course it's going up, but because people are slowly learning how to prevent themselves and have an awareness that at least the hospitals are prepared and make sure that they are not getting infected. We know our income has gone down, but we restricted ourselves. We have not done a pay cut to our staff, neither have we reduced or sacked any of our staff. The only thing we have done is requested our staff who had not taken their annual leave to take the annual leave during this time, and basically all of them have been able to go for the annual leaves. But basically we have not done any pay cut, and that we communicated, not because we have not been affected, and we have also not laid off or taken anybody for a compulsory leave. The healthcare system will definitely be affected, but I think it has a positive share as well. Most of the hospitals didn't have well-equipped ICUs, mostly the government hospitals. Most of them have bought the equipments in the ICU, the ventilators. After the coronavirus, then it means those equipments will be used. And if this corona didn't come, then it means some of those mostly government hospitals would not be having the ICU equipment. Like when you look at the other branch in the Tharaka-Nithi, like the whole county, basically, there are only 2 hospitals and ICU. Now many other hospitals have brought up equipments to equip themselves, as much as the county has not been affected. So that is a positive aspect as far as I'm concerned. As Komarock Modern Healthcare, what I would want to say is that people seeking medical attention do not have to fear. Not only in our facility, but basically it may be something negative for someone to die in the house because they are fearing coming to the hospital to be because they think they are likely to be infected with coronavirus. But I have friends who have hospitals, and we as Komarock Modern Healthcare, as a duplicate of most of the other hospitals, most of the hospitals have been able to prepare themselves to make sure clients coming in to the hospital have not been affected. So Kenyans should not fear going to the hospitals to seek medical attention.
My name is Moses Wakuloba. I'm a public health officer, and I'm also the hospital administrator for Komarock Modern Healthcare. So as a hospital, we are prepared. When a patient comes, first of all, they will be checked at the gate. They will be asked where they are going, and they identify themselves. And then the first place they go to the screening desk. But before they reach the screening desk, they have to wash their hands. And then first of all, we prove that they have masks. There is what we call mandatory masking for all people, whether they are patients or not. Then they wash their hands, they go through the sanitizing tunnel, they go to the screening desk where they are checked for temperature. And when one has a temperature of 36.9 and above, then they are taken to a different consultation room, different from the normal ones. So they go to that room where they meet a doctor who is ready for them. They will be clerked differently. They will be asked more questions of whether they have been exposed and all that. Then if yes, they are highly suspect patients, without interacting with the general patients that are there in the outpatient, then we put them in a temporary isolation room before we make arrangements and transfer them to a COVID licensed hospital. And in this case, we have Kenyatta University Hospital that is just here. So we refer them there, or we refer to Kenyatta National Hospital or Mbagathi. For the other patients now who have passed the temperature test, they go to the outpatient where they take their tickets. There is a special seating arrangement where we have made it in a way that there is a 1 meter distance apart. The seats are well indicated that you don't need to sit here, so that we allow that distance. Then from there, they are registered, they are taken to the doctor, they are triaged, and then after treatment, then they leave the hospital after taking their medicine very safely without any exposure. The other thing is we have groups of patients. We have patients who are pregnant. When they come, we have a separate wing where they go so that they don't intermingle with the other patients. The children who are 12 years and below, they also have a wing where they go. And the elderly patients, because of course, as we understand in regards to COVID-19, they are much higher at risk. So we have tried to put measures not to expose them to such conditions. It is very important to group people, Daktari, because, you know, right now we have what we call the asymptomatic and the symptomatic aspects of COVID-19, and now we don't know who is sick. Everyone is a suspect. And in this case, we have to put measures that all of us are suspected. So when you come, of course, we make sure that you don't mingle with other people, just like the government has put down the guidelines. Secondly, as a hospital, of course, it is a public place where so many people are meeting at the same time, and we don't need to allow exposures. So one is minimizing the exposure. We have to decongest the waiting area, the outpatient. The patients have to be delocalized. We have different plazas or centers where they are seen and waiting. So at any given point, we don't want to have crowding, which is the major risk for COVID-19. Yes, there has been a scare, because since the first case was announced, then of course as a hospital we are at risk, and even as staff and even the patients were fearing to come to the hospital. But currently, with the measures and the adaptive measures that we have put in place, all of us are no longer scared, and we are able, when someone is sick, of course, we are able to detect and say, yes, they are sick, they have fever. We refer them to the right channel to get treatment, and the stigma that was there is no longer a problem for us. Currently, we have not picked any case, any suspected case, but we have been very vigilant, and we are ready to get any suspect, and we will handle them the right way. But so far, we thank God, so far we have not gotten any suspected case. Yes, in terms of training and capacity building, since the outbreak began, we have been invited by the sub-county and the Minister of Health to train our staff, the clinical, and then ourselves as in our internal mechanisms, we have been able to train and capacity build our staff. All of them, they are trained and they are aware of what is supposed